I got into this work because I was chasing a boy, is probably the thing you shouldn't know about me, but that got me into doing this work when I was about 17. But my professional life started when I became a children's lawyer, and I worked out here in Campbelltown and on the south coast, and I was the Aboriginal Legal Service children's lawyer for 8 years at Bajura, a court I'm sure many of you know. And what I learned there was three things actually. One was I was working with young people who, being on the brink of going to jail, was actually not the thing they were most scared of in life, that they had other things that scared them more. The other thing I learned was that if you work in a place like a children's court for long enough, you start working with siblings of the children you met a few years earlier. So I wasn't seeing change in the lives of families. And the third thing I learned was, once you're competent, you become a tour guide. So I became a tour guide in a system where I could predict with pretty reasonable accuracy what the outcome of that child would be at court. But I couldn't predict what was going to happen in their lives. So that's my personal story. My population that I hold is sort of 10 to 18-year-olds who are at risk of going to jail. So that's my motivation for place-based work and working in this way.
My story probably started from when I was very, very young, and I've now realised I had the privilege of having two parents who were social workers and who are still social workers, very actively involved in working in Indigenous communities. And I spent the first 5 years of my life living in community with my parents. And we moved on from that back into the city, and my father took up different roles. But I think it always stayed with me in my subconscious. I made a decision when I left school to go to university and become active in business, and I was a management consultant, and that was a decision because I was so sick of living with social workers that I wanted to go to the other extreme. And I wanted to do all the things that my father always used to say he didn't have access to, the networks, the money, the funding, all the things that I used to hear at our kitchen table. I wanted to be a part of. So I went off and, much to my parents' horror, became a management consultant and was interested in downsizing and rationalising organisations and making profit. And when I was pregnant with my first child, realised that actually that wasn't creating meaning for me, and that I had a sense that I could do more and I could start to convert that 12, 13 years of experience working in business for social good in some way, and I didn't actually know what that would look like. But at that time I was living in Sydney, I'm from Melbourne, and I came into contact with Michael Trail, who was just setting up an organisation called Social Ventures Australia, SVA. You may be aware of SVA. It was Australia's first venture philanthropy organisation, and that was my pathway to start to connect to philanthropy but also to community. And through that experience, and then a subsequent experience which Tim referred to, of moving from SVA to advise the department, Federal Department DWER at the time, on Children's Ground, which was a place-based community-led change initiative, began to realise the importance of place and some of the challenges that groups of organisations and communities were facing. So my story sort of goes full circle, and I now find myself in a position where I'm running a philanthropic entity that's new, and I have the challenge to dare greatly, which is what we're doing.
So Louisa introduced me as the interim CEO of ARACY, which I am at the moment, but I also hold the privilege of being the CEO of Connect Child and Family Services. And I think what I've learned really from the last 10 years of being in that organisation and having my foot firmly planted in the reality of what a complex family and a complex child, or the complex situations that children and families find themselves in, has driven me outside of the organisation to start to think and try to push some change in higher up and in the systems that we've been talking about. I started, before all of that, I started my career as a teacher and worked in very vulnerable communities, or what we would, stereotypically call vulnerable communities, in schools where children really did come to school on a different playing field to others. And it was in a Year 3 classroom one day where I think was a watershed moment, saw that there was so much more to what we were calling education for children than what just walked through your door into your classroom. I spent hours and hours and hours talking on the doorstep of that classroom with individual children, and it made me just want to know more about the holistic thing that wraps around what we were calling education. And it started me on a journey to an honours degree in social science and then a PhD that crossed both of those disciplines. And now in my management roles, I'm very privileged to be leading 2 organisations that have children and youth at their centre, and how we change the systems to make that better at the centre of what they do.
Now I'm going to ask you to share a little bit about the work that you're currently doing around place-based approaches or collective impact, and also, where your perspective in terms of the future in Australia around this approach. So I'll start with Kerry.
Thanks, Louisa. So where I wanted to start today was I'm a proponent of collective impact, and I've worked in place-based settings since leaving the law. And I'm a real pragmatist that if there is a new way of getting people across sectors and communities and citizens to have a conversation about the change they most deeply want to create in their community, and that is a buzzword called collective impact, I'm going to use that. So if it is a fad, I'm going to jump on that fad because it's got benefit. It creates a common language and it creates a table where people can come together. And the reason I think people need to come together is, we've already heard from Tim, so beautifully put, that the problems that individuals and families and communities are grappling with are not ones that any one organisation or policy or government department or even sector can solve alone. And I think we all inherently know that. We all try in our day-to-day work to make different parts of a system work better for an individual. We do interdisciplinary teams, we do complex case management. These are all other types of responses to the fact that the system that works in a place is not serving its people. So I want to find out how we can create a system that serves its people, and I think collective impact has some promise in that. But another concept that I really firmly believe, and I think the evidence is now in on, is that if we know the problems we're dealing with are complex, then we also now know that collaboration across sectors is the most appropriate response to complex social problems. And if we understand that and accept that, the challenge now becomes, how do we become really good at being collaborators? We know we've become really good at best evidence and really great at service delivery. Our next challenge as leaders, as organisations and as a sector is to become really good at knowing how to collaborate. And I think that's the leadership challenge that we have to ourselves in our communities now. So if we think about what it takes to collaborate, the first thing I think when I think about the way forward for this work is we've all got some work to do on ourselves as leaders. And Michael has spoken really eloquently about this morning, but my take on that is if we genuinely are seeking to unearth the common agenda in our community, we need to set aside or suspend our own agenda first to allow common agenda to emerge, to really understand what the change is our community wants and what's our role in that. And that's the mindset we have to bring, the shift we have to create in ourselves as leaders, because we are going to come against great resistance to finding that common agenda. The systems that exist in our communities prevent collaboration. The way we are structured and funded, the way our sectors don't talk to each other, the way government is siloed and fragmented, the way we as non-profits compete for services and market share and funding, All of these things prevent collaboration. So we have to be strong enough in ourselves and our commitment to find common agenda and work towards community-wide change to subvert those systems. So collaboration at the moment is a subversive activity. Tanya James is in the room. I learnt this early from her, that sometimes you have to collaborate under the radar in order to make change happen. So the change starts with us. So if we think collaboration is subversive, if that's true, then we need to know how to lead against the status quo. We're talking about challenging the existing systems and trying to get them to move, and that is working on the margins, doing what Michael did for us this morning, laying down a challenge. Now, we all need to create change and work against the status quo. We all need visionary leaders who really champion the cause for change, but we need other roles as well. Who in our communities has the ability to broker across difference, to bring people who are not usually at the table together and find meaningful ways for them to contribute to the life and prosperity and change in a community? These are really important roles: the brokering, the facilitating, the convening, creating a place where people can learn to set aside isolated agenda safely in order for common agenda to emerge. How to hold safely the lived experience of the community and citizens within it. These are roles which I'm sure you play at times and your organisations may play to a degree. How do you step into those roles more fully? Because these are the roles collaboration and collective impact absolutely need in order to create community-wide change. And then my last point is, because this is about learning how to collaborate, making collaboration no longer a subversive activity, we have to be willing to learn from each other. Because this is not a new way of working, but it's still not the dominant way of working. So the only way to move from where we are now to where we want to be, where this is the way social change happens in Australia, is that we have to learn. We have to learn from what works, we have to learn from failure, and that means good access to data, places to learn from each other, and being in a constant state of curiosity to say, what more can we do? What more can we do? So it's the mindset change in yourself, the ability to learn how to shift a system, and the willingness to learn. They're my 3 things about the way forward.
I'm going to just take a bit of a slightly different angle because I'm here as a funder, as a philanthropic funder. And so what I wanted to do was just spend 10 minutes talking about who 1020 is, what's our bold goal, the journey that we've been on over the last 12 months, because we're very new, we're 18 months old, our approach, which we've called out the intent of opportunity child, and the key challenges that we see moving forward in this type of work. So just quickly, 1020 has come out of the wind down, the defunding of an old Victorian non-profit called Gordon Care, who worked predominantly in the last sort of 20 years in the child protection space. And I came on as the new CEO of an organisation that really had the only objective of becoming a venture philanthropy organisation. That was the directive I was given. So incredible opportunity. I find myself with $10 million and 10 years to do something with it. And I'm a pragmatist. I guess, I've come out of business. I'm very interested in results. I'm interested in seeing things happen on the ground. I like to have access to the intellectual conversation, the evidence base, to know what's working. But the pragmatic side of me also is, well, how the hell do we do this stuff? And let's just get down in it and start the work, because it is so hard, and Michael talked about this. And we've got some money to help fund, perhaps the seed fund, some of the early development in shifting where we are to where we need to be. So 1020 is really now a venture philanthropy organisation focused on reducing childhood vulnerability, the bold goal that many of us share from 22% to 15% over the next 10 years, and that's aligned very much with the ARACY agenda, which Di will talk about in a minute. And what does that really mean, though? And what does it mean for local community and place, which is our focus? And how do we get and start in the most effective place in order to ensure our investment has the greatest leverage? And I suppose for us, we decided that was pre-birth to 8, start with early childhood with cradle to career in mind, but really focus in on mobilising effort in place and supporting effort in communities around all children turning up to school ready to learn. So that's where we're at. What has our journey been so far? Well, haven't leapt into that because part of what we wanted to do was spend a little bit of time finding out what's going on. I mean, my experience of 10 years working at SVA and investing and supporting individual organisations was that wasn't enough. And scaling up and replicating wasn't appropriate either. That context is really, really important. Therefore, place is important. And every place sort of needs to work slightly differently, and community has a really important role to play. And I wanted to get an understanding, and the team wanted to get an understanding of what's going on. I mean, we know we do so many things well in Australia, and we have a very different system. And coming from Victoria, we've got a lot of integrated services, particularly around the early childhood space already. We have great institutes like the Murdoch Children's Institute that have been doing all this work around evidence. So let's just start to spend some time. It's a luxury to find out what's going on, because philanthropy traditionally in this country has done some amazing things, but it's also been driven on the egos of individual philanthropists who decide that they know what they want to happen, or they have a particular interest area, and they'll go to market to say, well, this is what we'll fund. And we didn't want to approach it that way. We wanted to actually get a sense from the sector, from communities, what is it that you need in order to reduce childhood vulnerability on the ground, and what does that look like? And how can you build a common agenda around that so that it's groups of organisations and community working together? And what would that look like if we were to invest in the capacity for that to happen, the infrastructure for that to happen, knowing that it's enormous, knowing that it's really, really hard when you start the work, but that you've got to start somewhere, and a bit of seed capital is really helpful, particularly when you're doing things to create new paradigms and shifts that a lot of others will say can't happen, won't happen, too difficult. So we spent a lot of time having conversations, and I guess where we got to was there's a lot of talk about collaboration, there's a lot of doing about collaboration. We have these really nice new language, I guess, which legitimises a lot of the work that people have been trying to move towards anyway around these principles of collective impact or community-led change, whatever the framing of it is. In Australia, I guess what we wanted to understand, and looking to some of the evidence, intuitive evidence that people like Tim have pointed to around what effective collaborative effort would look like around a common agenda, measuring to a common set of outcomes and indicators might look like, we asked ourselves the question, how do we put a framework and architecture around a group of communities that are interested in applying these principles, let's call them of collective impact, because it's becoming a common language here in Australia, I think, as Kerry has mentioned. Let's put these into community and with community and look at what we could support to test, trial, a development of a proof of concept stage. Because we can keep talking about doing it till the cows come home, really. But unless we have proof of concept and the pre-learning that comes before you get to proof of concept, which then gives you the business case to go to government, to go to other funders, to say this actually does work because we're actually getting reductions and this is the dashboard that's showing us this. Unless we have that, no one's ever really going to see it as a new way of working that has meaning. And I guess we want to work in a way that best leverages the resources we have, which is $10 million and a small team who have strategic capacity to provide coaching and support to leaders in communities. And we want to bring in other funders and align the efforts of many. Now, what right have we got to say we want to do that? Well, we actually don't have any legitimate right. I don't come from the sector, the non-profit sector. I don't come with a research background. But I do know, and I really, really resonated to me what Michael said, I do know that I don't think it's acceptable for children in a country like Australia, and 22% of children, to be living in some form of vulnerability, and particularly our Indigenous communities. It doesn't sit well with me. And you travel around Asia and you go to other places and you see the extreme poverty and the scale of it, and you come back here and you've got to ask yourself, why is it that a country like Australia can't sort this out? So that's where we got to with our ambitious agenda. And now we looked at saying, okay, well, what's some architecture? What's an intent that we can put out there with a strategy and an architecture to take to a group of partners and leaders, I guess, in the space who are also prepared to take the risk of testing some things out. So let's run a demonstration. Let's call it Opportunity Child, because that's kind of frames up the bold goal. Let's do a bit more work within that around what those outcomes need to look like and develop a common outcomes framework. And then let's work with a small group of communities that are looking to achieve that same goal. They might define it slightly differently, but looking to achieve that same goal. And what specifically can we do? Well, we could certainly look at funding the leadership capacity for action and the community conversations to build the common agenda, the support that's required for that to happen across the community, which a lot of philanthropists do fund, and Victorian philanthropy particularly historically has been very good at this, but it's done in isolation. That happens, and then nothing else. It's not linked to an outcome either. So there's that piece. There's a very important piece around infrastructure and architecture for shared data and measurement to enable a common agenda and to enable the technology platforms and the leadership and decision-making processes, the human element, for this work to start to inform practice and continuous improvement in community with community. And someone needs to fund some of that. And there are models like Promised Neighbourhoods where this work has started and is working. So one of the things we've been looking at is, well, what's working overseas, what's working here? And in particular, how can we support communities that are ready for shared data and measurement and certainly ready to start to collaborate, leadership to collaborate around some informed collaborative decision making? What is it that we can bring and fund? And the third piece that's of real interest to us, and which can't happen until we have the shared data and measurement piece, is new models for social investment. And there's a lot of talk about impact investing in this country, and we've got a number of demonstrations going on in New South Wales, I think, who are really leading the early stage development of these finance models, social finance models. And there's a lot of talk about what would a place-based social benefit bond look like? And I think it's too early for us to be having those conversations. What I think needs to happen is we need to get some proof of concept up. We need to understand how we align effort around common agenda. We need to put the systems and processes in place to actually share data, track measurement to outcomes and these results-based frameworks. And then we can actually, as communities, go to government and say, you know what, fund us for this outcome. We know we can achieve it. We've already set up the infrastructure to do it. And we can also go to government, particularly as philanthropy, and say, we've put the early stage investment into some architecture around this, some systems. This is stuff government can fund. And then philanthropy can fund the process of change management, which is often the human element, which is much more intangible, it's harder, it's about leadership, it's about decision making, it's about collaborative practice. Government's less likely to fund those sorts of things, but they could scale up the architecture piece. And I think, again, we've seen that happening in the US with Promised Neighbourhoods and the Social Innovation Fund and some of the leverage that you've had from that. So that's where we're at, and we're now sort of working with partners such as ARACY to bring a group together to look at what would the local effort look like to demonstrate and test this new way of working, and what would the learning system, the national architecture look like around that, with the overall goal of having population level change. A community being able to track how many children are ready for school across important developmental milestones and outcomes, which is not just about education, it's obviously the whole child. And what does that look like if we started to aggregate that across a whole series of communities? And then what does a conversation look like with government who need to sit at the table? And that's the ambition. And I think it can be done. And a lot of it is about us as individuals and as leaders from our different spaces coming to the table and saying, what's it going to take to make this happen? In a small way, not necessarily taking the whole system on. So in terms of challenges moving forward, I think everyone's touched upon leadership as being really, really important, and so I won't go into that. But I do think, again, we're at the stage in Australia where leaders are, and you know, all levels of organisations are getting a sense of what it might take. Whether we have the courage to really set out and do something differently is the challenge now. The risk of emergent practice and this idea, and I was telling Michael earlier, I was talking to a venture capitalist the other day about the need for early stage seed funding into new practice and social innovation in the same way that the venture capital market works on new business ideas. And in the US, you know, you've got Silicon Valley and there is an entrepreneurial mindset. How can we start to apply that and support communities in the non-profit sector to really look at new ways of working? And he said, you know, and I was explaining our ambition around Opportunity Child and what the intent of it was, but the need for others to come and share that intent. And he said, you know, there's a difference between stupid failure and noble failure. Stupid failure is when you just go off and do something with no evidence base, no understanding, and just some sort of gut instinct that it might work. Noble failure is when you've done a lot of work, you've got the evidence, you know that these things added up should move the dial, and you've actually put a lot of rigour and thought around it. And with noble failure comes learning. And I think that's really what we're saying is let's get a small amount of investment in the early stage learning across a number of communities who are doing all the things that we're saying need to be done in a results-based accountability framework to see whether that does start to inform practice across the board. So that's another thing is, I guess, others like us who are early adopters in this space and again have the privilege of dedicating all our funds and corpus to new ways of working, but bringing other funders to the table and exploring new roles for funders as conveners, catalysers, brokers, and actually even doing the work. And I've had some interesting conversations with community leaders who've said to me, but you're a funder, you just give us the money and then you go away. And the challenge is, well, actually, no, I don't want to go away because I've got a vested interest in this overall outcome. And I actually have a point of view at the table that needs to be respected in the same way as everybody else. And again, this is this mindset change. And I think the other challenge, and what I particularly like about certainly the principles behind the collective impact framework, is it's multi-sector. It's back to the old "it takes a village to raise a child" philosophy. And business needs to be at the table and philanthropy need to be at the table. And if they're at the table, they will want to see results or have some accountability and structure and discipline around the way we work. So I like this idea of bringing multi-sectors to the table to focus on the complex social issues, particularly around vulnerable children. How that happens, I think, is the question, and really think actually we just need to get in and start to prototype and do some work on the ground to explore that with leaders who are prepared to engage in that with some level of uncertainty as to how it might happen, but certainly with the end game in mind.
I've been asked to talk a little bit about how ARACY might fit into our whole notion of place-based work. And I guess some of you will know, but many of you may not, ARACY did a very large piece of work over the last 4 years and launched its National Action Agenda for Child and Youth Wellbeing. Now that gives an overarching framework, outcomes framework, for what we want to change at a population level to improve things for our children and young people in this country. As Seri has just mentioned, we've partnered with 1020 to actually utilise the NEST, and that's the name of this National Action Framework. The NEST, as part of the Opportunity Child Initiative, as a demonstration site, really, of how this might look. But I guess the bigger picture of all of this is that we want to create some disruption in the thinking. And that's what everybody's message is here today. We know we've got to do things differently because things aren't working the way they should be. We can see it. We keep talking the same things over and over and over again, but we're still sitting here on this panel today saying the same things. So we want to change that, and we want to change that through, as an organisation, or as ARACY being an organisation, being the glue that brings all of these bits together. That creates change at a whole lot of different levels. So we don't have what Marie gave us an example of this morning, where a home nurse visitor went to a family and had to make a report and then had no social contact with anybody in anywhere while the system dealt with that family. That's why we don't get this right. That's what we're trying to actually change and achieve something that looks different to that. And I think it is about, and I'm using Michael's words now, discipline, structure and measurement. I think that's what this is really about now. And we're talking RBA. Certainly in ARACY, we're doing work with Adam to transpose the outcomes of the nest into the scorecard, the RBA scorecard. It's a way of organising. It's not a way of prescripting what people should do, but it's an overarching organising framework that we have here that allows things like collective impact. It allows everybody to find their place. It's almost like I picture it as a big sticky piece of paper with your outcomes up there, and that's where we're going, and that's how we're going to actually change the world that our Australian children live in. But where do you fit your bit on there? And at the grassroots level, at any level that you're talking about, where do you fit under that overarching framework, and how do we know that all of that effort is aligned and it's making some change or some movement towards those outcomes, and we're not just going, well, we think it works, or it's worked for the last 10 years, we know it. How do you know it? Oh, because we think it works. We don't want to keep going around on that cycle. For me, it is very much about now operationalising that to the ground, because every question that I ever get asked when I'm talking this conceptual stuff, and Seri and I have really experienced this a lot in our work together, that sounds great, but what does it look like when that family walks through that door? They've got a relationship with a childcare worker. The childcare worker is probably the least experienced, as we would, or technically trained, to be having that complex discussion, but they're the most trusted point of impact, or trusted point of contact. They've got the relationship, but how do we know what that relationship is actually doing? Is it doing harm? Is it doing good? Is it is it a conduit to a whole lot of other formal supports? How do we know that when that family has contact in that service, that we're going to hold them for long enough while the more formal parts of the system step in to do their work? Or how are we going to know whether they just walked away and never came back again? That's what we want to know, and that's what we want to get this big level stuff down to the grassroots.
Hi, I'm Susie from Family Services Illawarra. Just a comment, really inspiring to hear all of this going on, but I'm still looking at that grassroots level and trying to figure out, where do the kids come in? Where is their questions, I guess, and where is their vision in order for us to make a difference?
Where do the children come in? In terms of co-design, that kind of principle, which I think is central to the way forward to the people you want to co-design it with are kids. We keep designing things for people, and that is never going to get us very far, because they're the ones who have to use it. And if we're not tuning in with the way that they would like things to be done, but they don't feel comfortable with it, that doesn't sit with their priorities. It's the same principle as working with families or working with communities. We have to tune in to now. That obviously is meaningful, more meaningful as kids get older and they get more capable of articulating their views. But in my view, it also relates to infants, that we can engage infants from the word go in exchanges in which they are equal partners, and that the ultimate building of participatory skills in older children depends upon that early process going well, and that therefore one of our targets needs to be, in our work, the kind of work that you do, in ensuring that that kind of interaction is happening early on, in order that the kids, as they get older, can be progressively asked their views on what kind of services they want and be involved in the design of programs.
I'll just make one comment to that. In terms of the NEST action agenda and the outcomes framework that's been delivered there, that was developed on the basis of 4,000 person consultation. About 3,500 of those people were either parents of very young children, and 2,500 were aged from 4 to 25, and they told us what they wanted. And it was to be loved and safe, it was to have material basics, it was to be participating, to be healthy, and to have a voice. And that's so important not to forget that that's what children actually, we know that really, we all know that, but their children have told us what they want as their outcomes. What are we going to do about it, I guess, is my question.
And I'll just respond by reflecting on what happened with a collective impact initiative called Children's Ground, which I was a part of in the early stages. And the community conversation piece that happened in Jabiru and was led by a number of elders and a ex-school teacher on the ground, with the community involved, talking to the children about what their aspirations were for the future and what did that look like. And it ended up being this incredible painting. I don't know if anyone's seen the painting that's come out of Children's Ground, but that was informed a lot by what the kids said and by some of the visuals that they had started to play with. And you know, in a sense, what the painting was saying, that a future for them needed to be strong both ways. It needed to be faced inwards to their community and be strong culturally, but they also needed to face outwards as global citizens. And it was incredible. And in a sense, that's how they bought into the process, and that brought their parents into the process. But that took 18 months. And I think this is the thing we need to understand, is that in order to engage the children and the people living the experience, it takes time, and we've got to respect that time and balance that then with the structures and the strategies that we put over the top. And this is the tension of this work.
I will say we do three things. One, when we use results-based accountability, we make sure that when you start talking about the targets, setting and all that, that actually children and families have a contribution. We changed one thing that really transformed our work. You actually can't come to a community meeting or any meeting that we hold anymore if you don't have a contribution. And the reason for that is because if you want to get work done, you got to get all the folks out who just come to the rooms, drop these bombs in the middle of the rooms, and then they leave, right? It becomes distracting, and we don't care whether you are a community member or a business leader. Collective impact is about advancing a set of results. So the admission is your contribution. And I will say that to a community member just as much as I would a business leader. And it changes the dynamic of everything. What was happening in the States is that community members would come and just be passive participants. They'd be fed in the evenings and hear report outs. And I asked a woman one day, why are you asking everyone else what to do for your children? And you actually don't seem to have a point of view about that. But I could say that because, one, we own the same results and indicators. But two, I was asking her because I was like, don't you have a point of view that you want to introduce into this room? And she did. And so to me, forcing people to come to settings, not just play out their typical pathological role, is important. The second is, we really do see that it is professional development. When I talked about not having a lot of folks of color, black men, who are in the rooms that I'm in, it's partly because they've never learned how to do this work. So for us, when we talk about raising $200 million right now, there's a group of 10th graders that we're working with. There's a Cesar Chavez Magnet School that we work with in Washington, D.C., who's a promised neighborhood. And those kids learn the strategizing with us. They go to Congress with us. They do those pitches. There's going to be a group of kids who actually learned what I learned in my late 20s and 30s. They're actually learning right now so that they can marry up their passion with actually knowing how to do the work and get something done.
I know I'm not on the panel, but I might just add something as well. First of all, this is, I know, about systems and it's kind of higher level. But it's important, and in terms of how does it impact, on the ground, I work at FAMS, and just last week, and I've had lots of these types of conversations, but was talking to a manager of an NGO who said that they have a service where they can provide services for children but also family support for families as well. And she said that there was a family that came to them just purely for their child. It was they needed some support for the child, but then discovered that that family had been on a waiting list for another service for 3 months, and yet they had a place available for that family. And this was a family that was really not coping. The mum was suffering from depression, there was domestic violence, but they sat on a waiting list for 3 months. So the system's not always working well. And so when we talk systems, we need to talk systems because it does affect kids on the ground, ensuring that every piece of resource we have is actually used for the benefit of children. So just, yeah, I know I shouldn't really be adding, but that was just more of a practical. Okay, who else would like to ask a question?
Hello, can you hear me? My name is Maya, I'm from FAMS, and we really do believe in this type of work, and we've been talking about it, I think, for a while around how we need to all collaborate and work together better. And I think we come across practitioners and people who really do want to do this work, but then come up with a myriad of different reasons that prevents them to engage this kind of work, ranging from, well, we don't have the money, or, our relationship isn't that great with our funder, or whatever the reasons may be. What do you think needs to happen for those people to break down those barriers and meaningfully engage in this type of work?
So the first thing, a couple of things come to mind when you say that is collective impact to me is all about readiness, and not every community is going to be ready. So if there isn't a group, there's usually every collaboration starts with a small core. So you need a small core group of leaders, and if they're more diverse, the better. But they have to create a circuit breaker in your community, and the best circuit breaker is marrying the power of data with the story of lived experience. By getting everyone who sits in there, everyone comes to the collaborative, most people I should say, let's not generalise, most people come to the collaboration table saying that the story that's in their head is there money here on this table for my organisation? Can I get more for my agenda, my programs? I need to grow. That's why they're there. You need something that is going to elevate in their mind, and that it's data and lived experience that take people out of common agenda out of isolated agenda into common agenda. Michael did it for us this morning. No one in this room will forget that there are 16 million young people or children in America living in poverty. That it calls you to a different action, and that's what data does.
Hi there, my name is Rebecca from the Blue Mountains Aboriginal Healthy for Life program. I'm just really interested, I'm just wondering if any of you have had experience with working with the larger organisations such as Health and Facts. Have you had capacity to share the lived experience of communities with those larger government organisations, and if so, what success have you had, so when you're talking about these collaborative efforts, are we just talking NGOs, or I'm just wondering what your experience has been in broaching that connection.
I'll just briefly comment and then pass on. But yes, in a nutshell, talking to all sectors, and all sectors need to be at the table and understand what their role is, which is part of the challenge, is what's everyone's role in this work, and it is different. And again, going back to the experience of Children's Ground, that was actually incubated initially. It was a networked incubation in government. Now, separate issue and discussion as to whether it's appropriate for government to incubate a community-led initiative. But government, there was a collaboration within government across departments. It was under the radar so that it wouldn't be sabotaged, but there was a specific learning agenda and funding going to it, and it transpired into a significant amount of funding into the Jabberoo community for that piece of work. And we're involved in a very early stage initiative in community with government at the moment, and it's emergent work, but government is at the table, and they've put a very small amount of funding on the table, but it's actually resources. They've allocated a number of people who have access to data in government to bring that, to the sort of the more the desktop analysis work of systems flows and what's actually happening in that particular community. And government has committed to learning, being a part of the learning journey and feeding back new ways of working and engaging with the community into their regional leadership structures across different departments. And that takes time, but those conversations are happening and it's active. It's actively happening.
Can I just give you a micro example of that and what I would think is what we really want to do at a much bigger level, but I'm sure my colleagues in the room won't mind me talking about them now. I have two people here from the Blue Mountains Consortium and several people here from Wesley Mission. And we have had what I would consider to be a remarkable partnership amongst a large NGO and a little consortium of much smaller NGOs to deliver a particular program, the Brighter Futures program. And that started because the people in the Blue Mountains Consortium wanted to do things differently, and we weren't allowed to by a department, actually. And we didn't get the funding in our own right, but we did go and look for a partner who was philosophically aligned to how we wanted to work with families, and we worked our butts off to make that happen. And we got something incredible out of that experience. We got the wisdom and knowledge and infrastructure of a larger organisation that we could leverage off. But they got our wisdom of what it looks like to work on the ground in our particular community because we had the relationships with those people in that local community. And I think that we would all attest to have gone from strength to strength in that, and also been able to influence, not as much as we'd like to, but certainly have influence over the department that funds us. And we continue to have those conversations, and we continue often to be the people that they come to ask questions of about how does this early intervention and prevention work on the ground, how do we get better at delivering this program or that program, all the programmatic questions come out of that. But it's because actually as a group of people we decided that we wanted to do something differently, and we pushed and pushed and pushed until it happened as a group, and we're still pushing. And I believe that the families that we have in contact through that consortium and through that partnership with Wesley Mission are very, very, very well served by that program in our particular context because of where we decided to go as a group.
I'm really interested in hearing from Michael about what people in the 61 sites have got involved, what range of people and so on, because the discussion starts from this issue that, is this the NGOs that we're getting involved? Who exactly is involved in this partnership? Well, if you take the perspective that I was putting this morning, that these are complex problems which deal with the conditions under which families are raising young kids, then the issues we have to deal with are far broader than the kinds of things that NGOs on their own can do, NGOs on their own or collectively can do. So we need, if we're thinking about the housing issues or transport issues or financial issues, or, as Michael said to us this morning, the total capitalist system and how it functions, and how it disadvantages people and how inequality disadvantages people, then we've got a huge agenda. And that means engaging potentially a huge range of people in this enterprise. A genuine collective impact approach will involve businesses not just as funders, but as people whose businesses might have an influence. If you think about something like obesity, then the issue is let's not just focus on exercise programs and nutrition, teaching parents how to cook and so on. Let's also focus on where the fast food outlets are and what quality of food they have and what kind of regulation there is of that. And that starts to involve businesses and governments at all sorts of levels. And if we're right that these social problems that we're grappling with are as complex as this, then that's the people that we have to engage. It's much bigger than just thinking that this is a service-driven kind of thing where you engage all the, the government departments and the non-government services in that area in identifying common goals. We have to think more broadly than that.
Tim is absolutely right. And when I was talking about systems being designed to really crush people, the Republicans in the United States really give us a few business leaders, wonderful blueprint of how this plays out. They are masters at actually getting collective impact. They have a group, two brothers, Koch brothers, have formed a group. Sole purpose is to turn back voting rights right now. The reason why they want to turn voting rights back is because populations are changing. California is already a nation of color. More than 50% of every child born is a child of color. They're doing the math right now. They realize they're in a big trouble. They produce so much model legislation and get it passed in the states. North Carolina, South Carolina, Mississippi, Louisiana, making it harder for high school kids who graduate to vote, etc. But they're doing it in a collective impact way. They're not starting with a program or service. They're using power, money, policy, and systems. And they're actually transforming systems. If you want to see good collective impact in the states, look at what our criminal justice system is doing by privatizing our prison system and then negotiating with cities to guarantee occupancy rates. Think about that, folks. You privatize the sector, then you go to the very folks and say, you know what? I want your tax breaks, so you have to guarantee us that we will be occupied at a certain level. That is collective impact. So I wasn't really just trying to be provocative when I said systems are designed to do what they're doing. There's a group of people out here that we should really learn from because they actually know how to do this work. And I'm giving you two examples where nationally this is having huge impact on folks. The number one barrier for African-American males or Latino males in America is getting a felony for marijuana use before you're 16 years of age. While in white communities, that's just a slap on the hand and they send you home to mom and dad. So right now, you take a child out of the workforce, 15 or 16, then you say, well, where does he go? That becomes the feeder system to the guaranteed occupancy rate. See how beautiful that system works? Same thing is happening in these other areas around voting rights. And while in our sector, we lead with a program. We lead without a long-term play. We lead without a 20-year agenda. This stuff just didn't start because President Obama became elected. These folks have a very long and deep agenda for how they're going to move change. And so I'm just inviting us to think about that as we think about who we want to have in the room, because our opposition in many cases is doing the exact thing that we're trying to learn from. So when you want to talk about proof of concept, we can show you a whole lot of them. For some reason, though, our folks just don't seem to figure out how to play together to do this.
Hi, Carolyn Quinn. I've been using results-based accountability with NGOs for about 10 years and working with fledgling collective impact groups in various forms and various sizes, from the micro to sort of bigger patch ones. And one of the things that I've noticed, because I come in, do my thing, and then I'm moving on to the next, one of the things I've noticed is a major challenge is the maintaining the momentum over time, particularly given the turnover that happens on the ground in services and so on. And there can be kind of backtracking and things that occur over time. And I'm just particularly interested to hear the panellists' view on the strategies or ideas of how you maintain that momentum of the common agenda for change.
So I think there's quite a number of strategies. The first one is, we go back to the art of community organising. If you have a cross-sector group who bring different skills and levers for change to the table, some will have their peak and move on at different times to others. So like you think like your own board, you don't want your whole board moving on at once. You want to be refreshed and renewed in a way that keeps the momentum alive. So cross-sector engagement is actually a really key way, because some parts of a community are able to sustain for longer than others. But the other one is you've got to constantly look to renewal. Who are the next community leaders? How do you bring up young people into community roles? How do you keep telling the story of success? Where are the early wins, even if you've got to construct them in the beginning? Data being the way to plot change and progress over time that really shows that by working together we get greater traction and greater progress. So it really is this art of community organising, understanding human motivations to be at the table, feeling like everyone's got a contribution to make, that it's making a difference, and this is the bigger picture as well as the micro.
Our experience in working with groups who have been trying to do this kind of work have been usually service groups, NGOs and government and so on. It's usually communities for children type funding, is that you do get this initial rush of enthusiasm and you get some people standing out as local leaders and so on. You get a group that works together for 18 months, 2 years or whatever, builds a level of trust, and then the sustaining of their vision and their efforts gets undermined when there's a turnover of personnel within that group. So just as all politics is local, all collaboration is relational, and you need to build trust among individual people to make this work. So in terms of how do we get round that? The dilemma is, I think the solution lies in you've got to sell what you're doing up, out and down. You have to sell what you're doing up to the people who the people who are involved in this represent an agency, a government department or an NGO and so on. They have to have the ongoing commitment of that body to this process, and therefore committed to their group, their agency, whatever it is, replacing that person or having a change process, a person, building the next person in, kind of thing. You have to sell the process sideways if you've got a collective group. Sideways means you've got to sell it to the other people who aren't involved in your actual group. The group itself develops trust, but you've got colleagues who aren't part of that process, aren't part of the central planning process. You've got to have, everyone who's on that group has to involve their people. And you've got to sell it to other services, not just your colleagues, but the other services. And finally, you've got to sell it downwards. You've got to sell it downwards to the people who are the consumers. They have to believe in this process and be part of it so that they own it and they won't let it die. And so if you can do all of those things, I think you've got a stronger relational and structural basis for maintaining for sustaining the whole enterprise.
Sorry to be microphone hog on this one, but we had Liz Weaver from Tamarack Institute out here last week, and she just told a story to this that I thought was worth sharing, because the other thing that sustains every cross-sector collaboration, collective impact initiative is, of course, the investment in the infrastructure of the backbone. Who is the organisation that wakes up thinking about the health and performance of the collaboration and goes to bed thinking about that? There's usually, you need a small core of people that do that. But her story was they had this really lovely way of convening their community around cross-sectorally over the long term, which they called the Table of 40. So 10 from government, 10 from business philanthropy, 10 from the service system, and 10 people with lived experience. And by that table, you get balance across the voice and power differentials and all those things that matter and influence the way people work together. But in their Table of 40, they had 17 people leave within a 2-month period. And they actually thought, we're collapsing. And their Table of 40 had first been brought together by invitation. and relationships across the community, but they decided to put it out to selection. They got 170 applications. And they saw that as this incredible inflection point in their collaboration of renewal and this story of together we stand. And they actually considered allowing everyone on and realised that was completely unwieldy and went through a really transparent and open process about how they filled those 17 roles. So you can't look always to attrition, natural attrition, as always being something that's going to derail you. Where's the opportunity in it?
Hi, this is a question for Michael. I'm very curious about the best processes you used with community and services and the whole, every stakeholder to your collective impacts that has been described to get these 10 shared results and 15 indicators, and particularly those 10 results that truly resonated with community, like with the parents that were impacted by the poverty of their children and the children themselves, so that they meant something to everybody and was in a language that everyone shared the same aspiration and call to action about what to do.
So the 10 results and 15 indicators of promised neighborhoods really came really top down first. Because the political opportunity was to design a program for President Obama to implement. So it came from us being able to lift up the voice, wisdom, and experience of community, because 10 results and 15 indicators are not really unique to promised neighborhoods. It's things like children entering school ready to learn, they're proficient in core academic subjects, et cetera. And so there's no argument really on the 10 results and 15 indicators. The conflict usually comes with how they're carried out in community. So the 61 community leaders who actually run promised neighborhoods in the country, their job has been actually to do that translation, to actually, when you talk about children showing up to school able to read at third grade reading levels, what does that mean? It's their job to make sense of that. So there's really not a lot of conflict around that. What we have found is work avoidance becomes often trying to select where you start. What I say to folks is start where there's momentum in a community and be done with it, because you can always build out the cradle to career continuum. Some people start on the back end, some on the front. So the answer is they were top down to start, but they were things that communities have asked for more than 40 years about their children being ready to succeed. And so the sell was not with the family. The sell was with us actually being able to do what families said and get a program implemented at the White House and then get it rolled out across the country and now to sustain it.
Mine isn't actually probably a question. I just want to take the opportunity to say I'm so grateful there's people like yourselves out there that are looking at the big picture, because I'm certainly still at the grassroots stuff. I'm feeling exceptionally overwhelmed. The things that I see daily are the children and see, feel and react to children's pain and parents and all of those things. In our community, we're having the fights about just trying to keep services within our communities so that we can offer and be collaborative when we've got no one to work with. So I'm hearing what you're saying, but I'm also feeling that what I'm doing in my hours of work is still working at that small stuff and not seeing the big picture. And I've always had the sense of belief that out of little things, big things grow. And when you talk about being so big, I'm just feeling absolutely overwhelmed at that. But I thank you, because some people have to, do what you guys are doing, and kind of like I'm grateful that I'm at the ground roots. Thank you anyway.
Okay, thank you. So I think on that comment, this might be an opportunity for the panel to sum up and give any response to that, and anything else you might like to say to finish off. Who wants to go first? I'm happy not to. Okay. Anyone want to respond? Yep, Sarah.
Look, my only response, thank you. And I think the importance of the work that we're talking about and systems change is that everybody does their bit at the level that they can. And so everything is important, and the work that you do is important, and it relies then on a whole lot of others to link in and do their bits so that the whole system is working together. And I think when we talk about collective impact, that's what we're talking about. And the challenge is that means you've got things going on at local levels and communities, sort of at that horizontal level. And then you've got that vertical alignment that goes up right up to social policy and federal outcomes frameworks and funding mechanisms. And how do you bring all that together? So my comment would be that's the challenge of this work, but that everybody plays a role in the system, and it's an important role. And the chief objective of collective impact per se is to align all that effort to population level change, which is what Michael's talked about, so that everyone's contribution has meaning.
Thanks for your comment. I think that you are actually the person, or people like you, that provide us with a conduit to be able to tell the story about what we need to do on the ground. And that, as Seri said, everybody has their part to play, but we actually need to hear that voice, because you know where it works and where it doesn't work. You know the family that comes through the door to you that you're working with. And that needs to go up and down the communication continuum, I think. Or I don't know if a continuum goes up, across, for this to actually be effective in the end.
In the communities that I've been involved with around this work, I think I've been able to discern 3 types of narratives, and you've just given voice to one of them. I think one of them is the narrative of consensus, and that usually sounds something like, I've been working in this community for 10, 20 years, and I have put my heart and all of my waking hours into wanting to see change, and I have not seen the change that I expected. And it's a group of leaders coming together, sharing that sense. That usually ignites something, and it's a slow burn for change. The other narrative is this urgency one. It is no longer acceptable for the children in our community to have these outcomes, and we will build a coalition and we will fight as hard as we can which is a different type of narrative. And then the third one that we've been discerning is one around self-determination, which is we're taking our own community agenda back from the hands of others that have held this agenda for too long. And in my experience, that's a voice of Indigenous leadership. This is a vehicle for self-determination. So every one of those narratives is valid and right, and probably all right at every time in that community, but they are all a pathway to system, community-wide change. So the one you're in now doesn't have to stay the one you're in. It will change.
Just another comment in regards to that too. If you put your hand up if you've ever been involved in an interagency. Yep, most people. Put your hand up if you think often it's a bit of a waste of time and it's just a bit of information exchange. Okay? So essentially, collective impact can be used by everyone on the ground by actually getting into your interagencies and actually looking at what do we want to change, what do we want to turn the curve on. If you're involved in a DV group, what's the data around DV? What can we all do to turn the curve? What can we do around child protection? I think that even people on the ground have got the most to offer in this, and it is about having those conversations though. And that was going to be my question to you, but obviously we've run out of time. But let's be thinking about this. How do we do that linkage? The linkage between the local conversations and the interagency work and what's going on at the top level. We need to do that. And I do believe organisations like mine, FAMS, has a role to play in that. And I hope that we will be exploring that further, and other peak bodies. But I think it's really important that everybody's aware that, this is the way of the future. Even when you heard Marie Walk speak this morning, they're looking at systems, they're looking at new ways of doing things, and it's really important for all of you guys to be informed of the new direction. When you look at the FACTS districts, they've all been aligned now in with the health districts. That's all part of the localisation and planning. You're all going to have local district reps, district directors, and it is about being able to align yourself so that you've got some power to go and talk to those district directors and get some movement in your community. So, you can make a difference, and hopefully some of this can help to equip you to be able to go into your communities and lead. Thank you.